Smith, a Dayton, Ohio native, was a daughter, aunt, and friend with a passion for caring for others that led her to the field of nursing. She was motivated and welcomed into the profession with open arms. She was not, however, given the guidance, support, or awareness needed to navigate the hostile work environment she soon would enter. In an emotional narrative titled Letter to My Abuser, Tristan describes her unbearable experience as a nurse and states, quote, "The law doesn't protect us," end quote. On August 7, 2023, at 28 years old, Tristan died by suicide. I, similar to Tristan, am about to enter the most trusted profession with the goal of making a positive impact on every one of my future patients. Furthermore, I am acutely aware of how unsafe the hospital setting has become for bedside nurses. One of my greatest fears is experiencing the trauma that so many other nurses have endured that has resulted in them leaving the field. According to a 2019 ANA survey, 1 in 4 nurses experiences workplace violence. This is also a primary reason that 1 in 5 nurses leave the profession every year. Violence in the workplace, on top of exhausting pressures of being tasked with inappropriate patient assignments, are leading causes of nursing burnout and are significant contributing factors to the current nursing shortage. To address the issue of short staffing, Ohio presented House Bill 346, which emphasizes the need for the volume and acuity of patients to be considered in making nursing assignments. In 2021, the bill was amended to require that hospital systems report their annual staffing ratios to the Department of Health. Additionally, House Bill 681 is intended to prevent workplace violence by requiring the submission of annual reports of violent events that have taken place. This retrospective and covert technique of addressing the traumas that our nurses face every day is not enough. We propose the implementation of a state-regulated and mandated safety monitoring system to provide public access to standardized safety concerns raised by nurses. Our idea, which already has a prototype thanks to our team member Janet, is an application that allows for nurses to report their safety concerns directly to an organization such as the Ohio Board of Nursing. This pool of data, consisting of nurses' cries for help, will be made publicly available in a timely fashion. Transparency of this information is a key and lacking component of the inadequate systems that are currently in place. We ask that legislators collaborate with professional organizations to mandate that nurses have a duty to report their safety concerns in order to protect them from fear of retaliation. Further, this compilation of publicly available data will allow for nurses' voices and concerns to be heard outside of the confines of their employer. Researchers and policymakers can consider this data in decision-making regarding nurses' rights and responsibilities. The goal of this pitch is to amplify the voices of nurses who have been silenced for far too long, implement policy change related to staff ratios and workplace violence, and decrease the nursing workforce shortage by improving employee retention. Thank you.